Hello and welcome to Level 4 Health and Social Care Unit 402 Communication Unit. And we're now looking at part 2 of the unit, which is barriers to communication. The objectives of this part are to address criteria 2.1 and 2.2. 2.1 wants you to discuss what some of the main barriers to communication are and how these can be overcome. And then 2.2 wants you to identify a variety of means of communication, alternative to maybe just the spoken word, alternative to the sort of just regular intervention you do, focusing on people with special requirements. Okay, so we're going to look at what those interventions. I will refresh some of the more routine interventions, but we're focusing on those. So just reminding us what is a barrier. Normally communication is a two-way process that normally goes quite well, especially if people's quite skilled, but it doesn't always happen that way. So a barrier is just something that interferes with somebody either sending the message or receiving and understanding the message, really. Um, and that can be for various reasons. So those of you who've done the level 3, we have addressed this in level 3 communication. So I know you've got quite a good idea of what some barriers are and how you might overcome them. So before we go on, maybe you can stop and give it some thought and refresh your ideas on some of these main areas. One of them is language issues, cultural differences, emotional issues, sensory needs, physical and environmental issues. So think back to what you did in your level 3 and maybe jot down some ideas for each one of those before you move on to the next slide. See what you can remember. Okay, so just to refresh the things that we did in level 3, hopefully you've jotted down some of your own ideas, what you can remember. Let's have a little look. So language, if people don't share the same language, that can be very difficult communicating. One of the long-term options is to learn another language, or maybe to have staff who speak another language so you could use them for support. However, if you're dealing with sort of important information, like gathering background information, creating care plans, you might well need an interpreter or a translator. So what you'd have to do is to look for specific services, which are generally available. You might need to bring somebody in, especially if you're doing something very important like a case review. Accents and dialects, strong accents and dialects from different parts of the country can make it difficult to be understood. Um, we're not assuming that people should get rid of their accents completely because that's part of who they are. But we are saying that maybe if you have got a very strong accent from a different part of the country, just need to be sort of conscious that the person on the receiving end might not understand it. So there's a lot of issues about checking in with people. We know that's part of active listening, to check in and see that people understand you. But also maybe to speak sort of maybe a bit slower than you do normally, and speak a little bit more clearly, especially if you're aware there are certain words that you use in your dialect or accent that maybe other people don't use. Maybe change those words or just speak them sort of very slowly and clearly, and then check in afterwards um, to make sure that people are understanding you. Slang, jargon, long words, these are all issues of communication. Slang can be very much related to different areas, different age groups, different communities. So you have to be conscious and checking in that people understand it. The best thing to do is try to avoid slang and sort of stick to your main language, really. The same with jargon. Those of us who work in the healthcare sector have a terrible habit of using jargon, using initials for things that we know because we've been doing it for years. But to somebody who's new to the care environment, especially a service user, it can be very strange and alienating. So we need to be really, really aware of that, and try not to use these initials or short forms whenever we can, because the person you're talking to isn't a healthcare expert. You are, but they're not. So just try to avoid that. And also long, complicated words. When you're explaining something to somebody, use the most straightforward words you can use. You don't need to use a complex word when a simple word will do. Especially if you're talking to someone again about their care plan or their condition, and it's really important that you get the information right. The environment, it's important that people are comfortable in a conversation. If they're uncomfortable, it makes it hard for them to communicate, their concentration goes. So make sure that the seating, we talked a little about how you should seat and position yourself in our last session. Think about things like lighting, background noise. If someone's elderly, a bit hard of hearing, having the TV and the radio on when you're trying to talk to them about something important is not really very helpful. And also, if people are in a chair that's uncomfortable or sitting in a way that's uncomfortable to them, or if the room's too chilly or the room's too hot, it means that it's very hard for them to concentrate on what you're asking them. Things like basic needs, if they haven't got their basic needs, like they're hungry, thirsty, or tired, that can be really hard for them to communicate. So make sure, people have got up and had their breakfast before you sit down and do a sort of an hour working on their care plan review. Or, make sure they've got some water or a cup of tea to hand, so that they don't get too thirsty if you're having quite a long conversation. And obviously, if someone's had a bad night and hasn't slept very well, you might better to let them maybe sort of take a nap or catch up and sort of discuss that maybe a later time in the day when they're feeling a bit better. Physical and geographical issues. Most of the times you want to communicate face to face, but sometimes it's not that easy. You might be using technology. You might be doing what we're doing here, using the internet and having some sort of video conferencing or those sorts of things. So just really be aware of that there might be things that you miss in the communication process. When you're looking at someone in a tiny square, you can't see all of their non-verbal language. So it's that element about checking back with them and reflecting that's so important in that environment. So we're going to look at sort of more specialist needs now. The little bit we were just talking about now is something that we did as I said, in the level 3 sessions. But I want to just do a little bit more detail about some of the more specialist needs so you can think about how to overcome them. So sensory impairment is really one of the first specialist needs. Things such as hearing loss or visual impairment. And have a think about the sort of barriers that hearing loss it can be really, really difficult to communicate, especially if the person communicating with you isn't really aware of the extent of your hearing loss. It can be a problem. So you might be trying to do something on the phone. That can be really difficult. If a service user is coming to see the GP, they might be in the waiting room. It might be noisy and crowded, and they might not be able to hear, or they might be embarrassed to sort of say their personal information too loudly. Again, with hearing impairment, people who, when they're talking to someone with quite strong accents, it can be difficult to understand them. So if you know you're working with someone with a hearing impairment, you have to think about sort of being, again, even more so, slow and clear. Maybe let them see your lips, see your face as well. And sometimes, especially because we do a lot of electronic recording when we're looking at care plans and reviewing things, sometimes we forget all of our non-verbal contact, and we sort of just, talk to the person but stare at the screen as well, sort of like I'm doing now. And that means that the person's missing out on eye contact. But if they've got a hearing problem as well, they might want to see your lips moving, and they might want some eye contact with you. If you don't stop and get that eye contact, you don't know whether they've got lost along the way. So really think about that with hearing loss. With a visual impairment, it may reduce a service user's ability to see faces, to see your body language, to see that you're actually understanding what they're saying, and following written signs. If there's a sign up on the wall, they might not see it. It might be blurred, or they might not see the full definition. Or they might not be able to read leaflets, so you might need to think of another way. So if you've got some information that you would normally give in a leaflet, you might want to get an audio version done for them, so they can sit and listen to it a few times, so that they've actually got the information well. Service users with a learning disability can have very complex needs. The learning disability itself reduces someone's ability to understand new and complex information, and hinders them in learning new skills sometimes. So they can often have significant barriers in communication. Some people with severe and profound learning disabilities may have no verbal communication. Or otherwise they might just have some reading problems. It's, the span is huge. Most important thing to do is to really get to know the person and have a real good look at their care plan to find out what their level of abilities are, because then you know where you're starting from. If someone's got aphasia, which is a language disorder caused by brain damage, they can, not always use and understand language effectively, even though it seems that they might be able to. There may be some words that just don't come to them, and that could have been because of the damage of the brain. So you really need to look into this. And as I said, it's very much their personal care plans, their personal goals and objectives are really important. And speaking to another professional, if the person's new to your service, then finding out from another professional who knows them well, or from the family who know them well, so you can get the extent of their abilities, really. I've put a little video on there for you to have a look at. It shows about some of the difficulties with people with really profound learning disabilities. So it will give you some food for thought, really. Think about how you deal with that. Illness and pain. Being in pain will make it hard for people to talk. It's hard for people to concentrate. They might not answer your questions well because they're, so taken up in dealing with the pain and the discomfort. And usually it's very, very hard for them to concentrate. So maybe if someone's having pain from an injury, like a broken limb or something like that, or some other injuries, the important thing is to make sure they've had their pain medication before you have any complex conversations, and that they're feeling as well as they can. There are quite a few illnesses that affect a service user's ability to communicate, things such as stroke, cerebral palsy, motor neuron disease, and dementia. Some of these things you've talked about a little bit. Those of you who've done your level 3, you've done your unit on stroke, you've done your unit on dementia, and you know that people's communication is often affected. And it's, there will be difficulties in speaking, writing, reading, and understanding, depending on what part of the brain is affected. Again, Very important to read the care plan, very important to see what someone's abilities are. Some of the diseases will give people slurred speech, stroke will as well, or their voice quality is not strong. So you're going to have to do an awful lot of active listening. And again, I go back to one of the most important things of the active listening role is that reflecting and checking in with people that you've understood what they've said. So especially people with slurred speech, just get them to do it slowly. Make sure you remove some of the noise from around them so that you can both hear nice and clearly. And then get them to sort of speak slowly as well, and then check in after. If the sentence you think has been a bit complicated, then check in and make sure that you've understood it right. Those with cerebral palsy, the way the nervous system is affected, that they may not be able to control their tongue, so it makes them speak in a sort of way like that. And their vocal cords can be affected. They can be squeaky or very deep or very grating. And it could be something that will get gradually worse until they lose their speech completely, if you've got something like motor neuron disease. Okay. With someone with dementia, it's more about trying to remember the words. And it really depends what stage of their disease at. They very often can't remember the right words, or they sort of forget how to put the sentence together, or you might say some words to them and they just can't remember what that word means. So it's all very difficult. So all of these factors, depending on the driver, can make communication quite difficult. The service user has mental health problems, can have difficulty communication in another way. Their actual speech and language isn't affected in that sense. Their understanding and their ability, but if they're sort of very, very depressed, they find it really difficult to concentrate. If someone's got very low energy, low self-worth, or they're just worrying about the same issues over and over again, they get very distracted from what you're saying. So it's not as if they've actually lost language abilities, but it can feel quite stunted because this overwhelming misery stops them being able to concentrate on what people are saying. Again, it's that checking in again. They can have something called tongue stumbling, where the brain's not really focusing on the action, so they sort of trip over what they're saying, and that sometimes some of these things can be side effects of the medication that some people might be on for mental health problems as well. Sometimes there are things that you can't see going on. Their mental health problem, might distract their thinking. So they're either worrying about the stuff that makes them miserable, or they have an anxiety disorder where they've got free flowing worry anyway. Or they might be having something like auditory hallucinations, so voices talking to them, which is interfering with them trying to listen to you. Important thing here is to, again, keep your communication sort of very short, sharp and simple. Give them little breaks in between so they can work through it. And again, always that checking back to see that if they can hear it. If they're having trouble with concentrating on certain areas, maybe break it down. So just, if you've got like 6 questions that you want to ask you, or 6 areas you want to review in their care plan, and they're really, really having trouble concentrating, then, just have today's conversation about one area and maybe resolve that, and then give it a break, let them go on, and maybe have the next conversation maybe tomorrow about another one area. Okay. We've talked a little bit about lack of common or shared language, and that may be a problem. We've talked about using jargon, um, and we've talked about using dialects. One of the most important things with dialects is try not to use the regional words. Try to use the words that, so I would say in English, try to use the words that are actually taught English, not some of the very special words that only come from a certain region. So like, the UK is split between the north and the south. Up north, they have some specialist sort of words and dialect. They're very strong and different accents to those down the south. But even down in the south, they do have some words that are local as well, almost like slang words that social groups might have. The important thing is try not to use any of those. Try to use the sort of, in my case, it would be sort of standard spoken English, and try to soften your accent when you're talking about something very, very important. We do know that interpreters are still also quite important. Service users from different cultural groups might not always interpret non-verbal communication in the same way, so you need to have a level of awareness. Differences in age can be a barrier for communication as well. Again, different age groups have different types of language that are used in different ways. So maybe a word that was used in my generation for one thing is not used in the same way for like the younger generation. Okay, so the generation before me, above me, gay was about being happy and jolly, whereas a generation from myself and younger than me, gay usually means someone of a different sexual orientation. So there's a word that sort of made a big change. So differences in age can be confusing, and you might have to sort of think really hard, and you might need to have a debate with some people about it. If you think she said this and I don't know why she said it, someone might say, well, actually, yes, older people used to say things like that. So it's important to sort of find out about that, really, and be aware of the way it's changed. Other conditions associated with old age, such as dementia or stroke, we know that they can create barriers, and we've talked about them before, really. And just bearing in mind, as people get older, there is more and more chance that visual and hearing impairments can get worse as well. So don't always assume that they, just because they could see this well last year, that they may not be able to see so well this year. So the important thing for people who have got visual impairments and hearing impairments, and who are older and who maybe are living in a care home with you and you have a lot of responsibility for, is to make sure they get their hearing and eyes checked pretty much every year to pick up any deterioration and changes, so that we're not assuming that they can read things when they can no longer see things, or they need their glasses changing. So some simple things to think about there. Also, the older group of people may not be as comfortable using emails, texting, electronic communications. And some young people might think it's sort of quite funny the way older people stumble over things, but they would need quite a lot of support and input from you. But don't assume, however, that anybody who's over 50 can't use WhatsApp and can't use apps, because that's not true either. Some people who are older just are interested in technology and are very good adopters of technology. So don't make assumptions. Don't make assumptions just because someone has age that they can't do this and they can't do that. It's all about checking things out and testing it out. Okay. But because of this, some older people might be not so confident in engaging into communications. They might feel, like younger people don't understand them, and they don't know what they're talking about, and they might not feel confident speaking up to people. So just be a little bit aware of that, and try to be encouraging and supportive, and trying to get them to engage or join in with things, really. But do be sensitive to those needs. There is differences in gender and the way people respond as well, and the way people communicate, and obviously cultural beliefs. We've talked in your previous level 3 a bit about cultural differences, especially when we looked at equalities. But there is research that shows us that men and women often have different styles of communications, and this can be be a barrier, where someone might be sort of worried or uncomfortable or anxious. The communication style of women is often very feelings related, and it's about building relationships. When women are more into creating friendships, can be more interested in social interactions, and they can be more emotions driven as well. So you can get feedback from questions on emotional questions a bit more from women very often. Now this isn't 100%, nobody's the same. There is just research that says that women tend to be more interested in those sort of emotional reaction conversations, and they're also more comfortable having them as well. Men tend to be more direct and straightforward. They prefer sort of direct, focused questions. They're not always so easy to talk about how they feel about something, and they're not always easy because they focus more on power and status. So it can be a lot harder for a man who's moved into a care home, and maybe up until he became elderly and infirmed, had a very powerful job, lots of responsibility, highly paid, lots of respect. Think about some of those things and about the way you are speaking to him now, because it can be quite difficult for him to communicate with people who maybe not giving him respect, but there's a lot of loss there that the person's got to deal with. So they might like something more matter of fact, really, and they might find it embarrassing to talk about their feelings more. Now, as I said, research shows us that they are, in my eyes, little stereotypes, but research does show that that is pretty much the way of it. However, it doesn't mean to say that there might not be women who prefer to talk in direct, straightforward ways, and who are more interested in power and status as well, and men who might be more interested in talking about their emotions and their feelings. It's just generally that's what we have. So don't quote me as 100% on that. Just say it's general, and you can find research to back that up if you want to write about it. We've discussed different cultures a little bit before. It's mostly about non-verbal communication. Eye contact, postures, some gestures and facial expressions can be interpreted quite differently for people from different cultures, and that can cause problems. So again, you need to check in with people and judge by their reaction that you're not offending them as well. For some cultures, maintaining eye contact when speaking to a person is actually considered quite rude, whereas we know it as part of, important non-verbal communication. While in others, if you don't maintain any eye contact, that's considered to be fairly disrespectful as well. So there are things to learn, and the important thing to do is if you've got a new service user who comes from a culture that you don't really know, try to find out about it. Obviously, talk to them, their family, and their friends. Be honest. Say, this is different culture. Anything you want to tell me about it. But also, you can speak to, there may be other staff who have the same culture who can be really, really helpful and who you might want to sort of bring in as part of your early conversations before you get to know the service user. Okay, so, or you might just have to do a bit of research, really, if they're not able to share with you. Okay. Challenging behaviour is something that can actually cause risk to you. So if you don't manage it, or don't manage it well enough, you can actually make the challenging behaviour worse. Very often challenging behaviour is connected to people with learning disabilities because of the level of damage to their brain. It can actually be connected with a later stage of dementia. And because of that, people can find it quite difficult to communicate how they're feeling when they're in this sort of challenging situation. So struggling with communication can lead to them feeling frustrated, and then their behavior might be challenging. They could hit you, they could throw things at you, they could swear at you, they could be all sorts of things, really. And sometimes for those sort of people, a very noisy environment or a very crowded, busy environment can actually make the challenges worse. And it'll make it almost impossible for them to communicate with you until they've calmed down and settled down and they've got a different space. Challenging behaviour, there's lots and lots of techniques to work with challenging behaviour. You could say it's often a whole course all by itself, really. But I would suggest you do a little bit of reading just to get some ideas. And then if you're interested in it, you might want to you can go into something in more depth. I've added a little YouTube for you with someone, a professional and a carer, just talking about the links between communication and behaviour, just for you to sort of join up those links and ideas. If you want to know a bit more about challenging behaviour, I've also put a link to a specialist website, challengingbehaviour.org, and they're pretty good, and they often can answer most questions you have. Again, if you are interested, please, there are little short courses you can do, so please look into it if you want. So how do we overcome these barriers? We know we want to. We're really looking at specialist interventions here, not the normal day-to-day things we do to overcome barriers, okay? Not the stuff that you've sort of focused on in your level 3. So using specialist equipment, there's a wide range of communication aids, and that can be as simple as a pen and paper, or it can be quite a complex electronic device. It could be an ordinary tablet or your phone, or it could be a specialist machine. And there are sort of things like apps that can go onto ordinary computer programs where people can actually use them to spell out words. It's pretty good if they've got sensory issues as well. They can do auditory stuff and then they can answer the questions. So some of it can be verbal, they can answer questions verbally. And for those who have hearing loss, they can do it by reading and typing their answers. There are also apps that support language development with all sorts of stimulating all sorts of areas, really, and they're usually supported and recommended by a speech and language therapist. So hopefully, if your person has some really complex needs, there will be an involvement of speech and language therapists who will give you some guidance to using this special equipment. The important thing is for you to learn how to use it as well as the service user, because if only the service user knows how to do it, you're not going to get very far. Other sorts of aids or more standard aids, such things as hearing aids, text phones, hearing loops that amplify phone calls and things like that. Electronic devices, texting alone has been fantastic for people with hearing issues. Most important thing to do, though, is when you give someone, especially if they get one of the computers with some of the complex programs into it. We can't just assume that, you know, they've got one and tomorrow they're going to start communicating with you. They're going to need time to get to know it. If someone has very complex needs, the best thing to do is probably, again, the speech and language therapist needs to intervene at the beginning to help people get used to the programs, and then also bring you, the staff, in so that you know what you're doing with them. And then in time, as they get better at it, they can start using it more and more. Augmentative and alternative communication is actually some of the more complex forms. So it's all forms of communication that are not oral. So things like signing and gestures, they don't need real special material. Maybe, you know, you could do it with a paper and a pen, really, making signs. Or you can just learn the signs and just use them yourself. There are also other systems where you can buy picture charts, or you can make your own picture charts and laminate them. Especially good if you're doing foods and things for menus. You can have a laminated sheet of all the different fruits and people can point to them. But there are things known as communication boards, which are, again, quite complex computerized systems, which will almost translates people's thoughts into speech. Hard to explain, but do have a look. There's a little bit of video of Stephen Hawking, who's died now, but you know, he was a genius physicist who had motor neuron disease and was extremely disabled in the last sort of 40 years of his life, really, to the point he had absolutely no speech. But he still carried on doing lectures, and he still carried on working on the Large Hadron Collider, and, you know, being a professor at a university. So his brain wasn't impaired in that way. It was just the motor ability. So he's an extremely clever man, cleverer probably by a long way than any of us. But because he was extremely disabled, he wasn't able to communicate that well. But he found ways. And again, because he worked at Cambridge University, and because he had a lot of physicists as friends, they all managed to create these systems for him. But the systems that were created for him have now been rolled out to sort of more ordinary people as well. Have a look at it there, and he'll tell you a little bit. You can see how his computer works and how he communicates with it. And also, there is Communication Matters. Click onto that and find out a little bit more about AAC, so you can get an idea of some of the systems. Specialist language. We use British Sign Language because I'm in the UK. A lot of other countries use American Sign Language. They are the two main sign languages for people who are deaf. British Sign Language is used in lots of other countries in the world, as is American Sign Language. So depending on what country you're in, maybe have a look and see which type of sign language you tend to use. Those of you who are based in Malaysia, they tend to pick up quite a lot of American systems, so I wouldn't be surprised if you use American Sign Language. British Sign Language is quite complex to learn. There are in-depth courses. You can do courses in them. But because it has a sign for every letter of the alphabet, and then you literally spell out words. It's quite complex and quite time consuming. And what's been brought in of late is a little bit, you know, more generic signs for certain things. A lot of people have gone on to learn Makaton, which is much more symbol based. So you can draw symbols, or you can just do the signs with your hands, but rather than spell a lot of things, they're symbol based. So simple things like thank you and hello, and I have pain. So if that's pain in my head, that's pain in my teeth. So there's lots of things to learn then. And a lot of people have started to use the symbol sign language like Makaton because it's that, you know, you can communicate a bit easier and it's easier to learn. So have a little look at that as well. There's a little video there, top 10 signs for nurses for anyone who's using Makaton. You'll find them quite useful. So have a look at that and maybe even having a go at learning some of those signs. The last specialist language is Braille, which is a lot older. It's a couple of 100 years old now. It's invented by a young man called Louis Braille, who was blind from birth, and it's for people who are generally completely blind or visually impaired. And you've probably seen it. It's a large card with punched dots that are in it, and the dots represent different letters of the alphabet. So if you see, you can see a book created in Braille, and the book's absolutely enormous because it's all punch dots, you know. So every letter represents. So books will be quite large, but you know, it was a wonderful learning thing for people who are blind, because obviously they can't do signing really and things like that. They tend to work better. There's a lot of auditory apps and that can be more helpful now. So instead of reading a book in Braille, they'll probably listen to an audio book and probably enjoy it more as well, because it takes it's a less work. But Braille's quite important for sort of letters and things like that. There's if you're sending a formal letter, say from the government or something, they'll often do it in Braille so that people can actually read it. And if you have a click on that, you can have if you have a click on layout 1, you can have a look at a Braille alphabet card. So you can see the dot configuration and get an idea how it works. Using a translator or interpreter, some issues to think about. One thing, there is a cost to it. We used to use family members very often, but this now is not really encouraged because it's a breach of confidentiality. Sometimes the service user might want to tell you something about themselves that they don't want the rest of the family to know. So that's a problem. So we don't tend to do it now. As I said, interpreters, there are drawbacks because they might not always get the meaning of the message that you're trying to put across. And when there's another person in the conversation, it becomes a three-way conversation. So you have to remember that you've got some added difficulty there as well. Sometimes you can get people who are particularly skilled at healthcare interpreting, so they've learnt the translation for some of the more complex health words, but some interpreters don't always know those words, you know, especially if they're very technical words. So it can be, it's not perfect, really. It's something to think about. And another thing is, again, you've got a total stranger hearing very confidential information about the person, and the person might not always be happy with that. So the most important thing is to remember that the service user is in charge of the conversation. It's quite easy sometimes to forget the service user and actually have the conversation with the interpreter because it's probably easier. But you must remember that you're actually talking to the service user, and the interpreter's sort of the person who's sitting outside the conversation, just passing it through. And that. So there can be pitfalls with that, which you need to think about. So remember strengths and weaknesses for using an interpreter. Using advocate can be often a better option. Someone who understands the needs and the preference of the service user. Advocate can be someone who might have a lot of background working with people with that particular problem, say if they've got mental health problems or complex learning disabilities. If someone's actually got years of experience working with people with those issues, can be really, really helpful as an advocate. But also they need to get to know the person incredibly well, because they're really representing that person. So they can be a family member, a carer, or someone again from a specialist organisation. But the important thing is they can't just start advocating for the first day they meet the service user, because they've got to get to know them, and they've got to find way to find out what that person feels and what that person wants before they can help you put a care plan together with them. So again, it's about the other person's preferences. Creating a conducive environment, we've talked about this before as well. It's about, going to a quiet space when you're talking about very private things, closing doors and windows so strangers don't hear what you're saying, turning down the volume. Sometimes the TV's always on, turning that TV down or even off if you want to talk about something that's really important. Some people make a little bit of quiet background music if they're just having some social interaction with the staff. Lighting, again, too bright might make it hard for someone to concentrate. Too dark, they can't see what's going on. You've got to be able to record information as well. So you need to be bright enough to make sure your notes are accurate. And also it needs to be bright enough for you can see the service user's facial expressions, and they can lip read if they need to. If you're trying to do some counselling or relaxation, maybe a little, you might want the lights down a bit lower then, but that's a different sort of conversation really. Environment should be well ventilated, neither too hot nor cold, because that doesn't diminish on people's concentration. If it's very hot, they get distracted. If it's very cold, they're too cold to think and answer the questions properly. And again, we've talked about seating and posture. Seating must be comfortable. If you're going to do a long care plan review, you don't want to be sat on hard, painful chairs, which again will affect concentration. Finally, we just need to consider the individual's needs. Okay, and this is all about using your active listening. Make sure to maintain eye contact. Do not rush. Do not interrupt them. Listen carefully to what they're saying. Make sure you're using their preferred form of communication, if it's verbal or signing or just listening and speaking. Make sure you're doing the one that they want to do. Otherwise, they'll feel uncomfortable. Make sure that advocate, if you're going to do again a review and they need their advocate, don't just do it and forget to invite the advocate. Make sure that you've taken the time to invite the advocate, to give them time to get to say, yes, I've got room in my diary to come. Remember hearing impairments. Make sure that they've got their hearing aids and that they're working. Make sure if you're using pictures or symbols that you have them already before the conversation, so you're not breaking up the conversation to go and look for them. If someone's got a visual impairment and they need their glasses, make sure that they have them and they are clean and they can see through them. Make sure they're all available. Don't get someone to, like me, you take my glasses off, you can show me anything, I can't see it. So make sure that if they're looking at their care plan and signing to agree it, that they've got the right pair of glasses on for that. Okay. Building trust and empathy, it's really about building relationships, making sure you have your background, and taking time to show your understanding of people. So that's the most important thing, really. And you are not going to communicate well with someone immediately. You have to develop those relationships. And the most important thing to do is to show, use your empathy skills. Show that you have an understanding of how they're feeling, and be open and honest at the times when you don't understand how they're feeling, because then they might explain it a little bit more to you. So trust and empathy is sort of more important than all that you can have all these sort of additional useful aids and systems, but if you don't have a trusting relationship, you're not going to get the answers you want anyway. Okay, so do remember that. Okay, well that's the end of part 2. I hope it's been useful. Thank you.